Most bad rhinoplasty results fail for one invisible reason. Not the surgeon, not the technique, but the cartilage inside the nose tip. And once you see this, you'll never look at rhinoplasty the same way. I'm Dr. Shim Ching, board-certified plastic surgeon, and I performed rhinoplasty for many years. Today I'm going to explain the single most misunderstood part of nose tip surgery, where the cartilage comes from, and why that choice determines whether a nose looks naturally or obviously done. While most patients will focus on shape, surgeons will focus on structure. And structure is what decides if your result will last. Think of the nose tip like a building. You can paint it beautifully, but if the foundation is weak, it will eventually collapse, shift, or deform. The nose tip is not skin. It's a cartilage framework that controls projection, rotation, symmetry, and long-term stability. If that framework isn't strong enough, the nose may look great at 6 months, but disappointing at 5 years. So where does this cartilage come from? 3 possible sources: septal cartilage, rib cartilage, and ear cartilage. Each one behaves very differently. Let me explain exactly when and why we use each. Septal cartilage comes from inside the nose. When it's available and healthy, it's often my first choice. It's straight, it's firm, and it integrates beautifully with the natural nasal structure. For many first-time rhinoplasty patients, the septum provides enough cartilage to refine the tip and maintain a natural feel. It heals beautifully, it feels natural, and it ages well. But this is most important, it's not always available. These are patients who've had prior rhinoplasty, have thin or small septums, or need more structural support than just the septum can provide. And that's when we move to rib cartilage. Rib cartilage gives us strength. It allows us to rebuild the nose so that it doesn't droop, collapse, or lose definition over time. This is especially critical in revision rhinoplasty, weak nasal structures, thin skin, and significant tip reshaping. When properly placed and shaped, rib cartilage can look and feel extremely natural. Remember, this is cartilage, nothing artificial is placed in your nose. Many patients will hear rib cartilage and immediately worry, but the truth is, when it's used correctly, you should never feel it, you should never see it, and no one should ever know it was used. Only trade-off can be a small chest incision if your own rib is used. This is often why we use donor rib cartilage, which doesn't require this. We only choose rib cartilage when the nose truly needs that level of support. Ear cartilage is softer and curved. It's helpful for subtle refinements, but it's not strong enough for primary tip support in most cases. I consider it a supporting player, not the foundation. Choosing cartilage is not a preference, it's a calculation. We look at your existing structure, primary versus revision surgery, skin thickness, how much support the tip needs, and how we want your nose to look years from now. For example, thicker skin requires more support. Revision noses require more rebuilding. Weak tips require more reinforcement. Here's what I want every patient to understand. Rhinoplasty is not about how your nose looks in photos at 6 months. It's about how it looks at 5, 10, and 15 years. A weak tip can soften. It can droop, it can become asymmetric. A strong framework preserves beauty. Good rhinoplasty doesn't draw attention to the nose, it brings the entire face into balance. That's why rhinoplasty is not just art, it's engineering. So when patients ask me which cartilage is better, my answer is always going to be the same. The best cartilage is the one that gives you the most stable and natural result. There's no universal answer. There's only the right choice for the right patient. If you're considering rhinoplasty, especially tip refinement or revision surgery, this is a conversation you should absolutely be having with your surgeon. If you found this helpful, like the video and subscribe. I share content like this so you can make informed, confident decisions about your care. And if you'd like to explore which approach is right for you, I'd be happy to guide you through this in consultation.